I think we can go ahead and get started. So thank you everyone for joining us. I know there was another session, the alumni panel, that you all just came from. So this is the industry breakout. My name is Dr. Thais Bingham Hickman, and I am also a Leadership Alliance alumni from 2004 and an NYU graduate. So I have come full circle here. I'm now the Assistant Director of the Leadership Alliance. And I'm so excited to have Courtney and Marcus here to answer your questions. So this is really, a way for you to ask some more specific questions about industry. So I will be monitoring the chat, Marcus and Courtney, and I think we can go ahead and get started. I don't know if there were questions left over from the prior session, but maybe we want to start there. If you do have a question, feel free to use the chat feature at the bottom of the screen, and I'm happy to help moderate those questions. Thank you.
Any questions?
Don't be shy.
So I think, let's see if I can remember. I thought there was one question that was left in the chat about doing a postdoc and was it required for industry. So I would say it depends. If it depends the role that you want to do. If you want to go into the research labs, they typically look for individuals that have a postdoc. And at Regeneron, we actually have a postdoctoral program. So I believe BMS does as well, where we bring in individuals finishing their PhDs, and they do a 3 to 5 year postdoc. And often they do find positions in Regeneron or at the host industry company after their tenure there. But I would say it's dependent on if you want to go back into the labs. A postdoc is very helpful, but there are other areas. So like in program management, members of my team don't have a postdoc. They actually came straight from their PhD. And in some cases, they didn't do they came with a master. So it really depends on what you want to do and what technical skill sets you have in industry. So it's kind of there's no one set rule.
Yeah, I agree. It's similar at BMS, and it also depends on, I guess, how, for lack of a better term, how high you want to go into the organization. If you do want to rise up kind of quickly, like if you want to come in and say, within a few years, I want to be in a management position, they will expect for you to have some postdoc training if you do want to rise pretty quickly. But if you're willing to stay there for a while and sort of work without as being promoted, honestly, for a while, then they will let you start without a postdoc. It all depends.
Thank you for that. And so we do have a few questions into the chat. So the first one is a question here from someone who recently graduated with their PhD and is interested in working in a collaborative team-based environment doing research. I've heard that in industry, people more so work as a team to meet the company's goal, whereas in academia, it's more everyone for themselves. Could you speak a little bit on the type of the work environment in industry?
Yeah, so it's definitely a team environment since no one department makes a drug on itself. Like we're in the immunomolecular tox, so we have to collaborate with, for example, the clinical pathology department to see if we saw a change in a certain type of cells, if they saw similar changes, and then we all combine our results together to give the toxicology package to the FDA. That was mentioned from the speaker in the previous panel. So it's very collaborative. No one company or no one group is responsible for a drug. You can never do everything by yourself, which is why learning how to collaborate early on is really, really important. If you don't collaborate well, you won't last very long in industry.
Yeah, I completely agree with Courtney. It's, Regeneron, we are dependent on our cross-functional teams. We have our research and development, that they use purely discovery work, but develop or identifies a target. But then they hand that target off to the clinical and early clinical team. So, if you don't have good collaboration or cross-functional work at a company, you can't succeed, because as Courtney said, no one person or group can do everything.
Thank you. So we have another question specifically for Dr. Newsom. It says, Dr. Newsom mentioned applying for jobs when she was applying for jobs that she was overqualified in some cases and underqualified for. I've been running into the same issue. How did you find the jobs that were the right fit? And are there certain job titles to look for that will help? Thank you.
So when I was applying, I knew that I had a PhD with postdoc training when I was in the process of applying. So for some reason, I thought in my head that if I just applied for a job that may say, oh, you have a BS or MS, you can apply for that as well. And I was applying for those, and I would get the feedback like, I think you're going to be a little overqualified for this. Or then I would see something that would have maybe like director, where you would have a PhD with experience, but I wouldn't have the 10 plus years of industry. So I was underqualified for those. So I think it's just learning how to read the job descriptions very well, because I guess I should have read more carefully, because they were pretty much saying that you have to have a PhD with X to whatever years of experience. So I was kind of ignoring that part, but I was just applying to what seemed that it would be a good fit technically, instead of really learning how to read the job descriptions. So I would pay close attention to what the qualifications are and to make sure that you are sort of within that right range. I guess another piece of advice is to look for jobs kind of, I don't want to say all the time, but look pretty often, because a lot of the jobs when they were posted, at least when I was applying, they may be posted pretty quickly and then taken down kind of quickly as well, especially if they have an internal candidate like Dr. Jones was mentioned earlier. So a lot of times you are sort of fighting against people who sort of know someone who knows someone. So it is best to get your foot in the door as early as possible.
Yes, thank you. Dr. Jones, anything you want to add to that?
No, as always, Courtney has a great answer, and she's still, I can't really top anything. Yeah, it's, really, it's the devil's in the detail. Like Courtney said, pay attention to detail, because that's part one of the application process. How well are you following the instructions and the details? Because, there's often those job ads are, like Courtney said, is a screening tool where they actually want to see those that are actually paying attention to those details and how well you address them, not only in your CV or your resume, but in your cover letter. So make sure you really address all those details when you're applying.
I know someone in the previous section mentioned the whole computer system and algorithms as well. I know for the position that I applied for, someone in my exact same postdoc group applied for my job as well. But there were like certain semantics in words, like for the immunologists out there, like flow cytometry and immunostaining, are the same things. But when the HR person gets this, the computer said you want someone who has flow cytometry. If I have flow cytometry and you have immunostaining, we have the exact same background, but my CV is going to get flagged as someone who may be a better candidate than the other person. So it's really important to kind of cater your CV and cover letter and use the exact phrases that are in the job description.
Mm-hmm. So we have another question for both of you. How did you know that you were interested in industry, and are there opportunities for mentoring and outreach? Also, in your industry role, is all of your scientific communication to other professionals, or do you work with other groups outside of the scientific community as well? So it's kind of three questions.
I'll let Marcus go first this time.
Not a problem. So I'll try to answer each one of them. How did I know I was interested in industry? So, I was in academia for 10 years and then had an opportunity just out of serendipity to start up a company. And, making that transition kind of opened my eyes and saying, hey, I'm always accustomed to writing my own grants and focusing on my one question in science. But I really wanted to start thinking about how I could make a broader impact. And one of the opportunities I get to do in an industry company is, through my research, I contribute to a very important issue. But through a pharmaceutical company, I can be a part of a team that makes a new drug that impacts hundreds of millions of people. One of the products I work on now is looking at COVID and looking at a new therapeutic. And I mean, just imagine if Regeneron's, we have something in phase 2, phase 3 clinical trials. If that therapeutic works, that would impact millions of people around the world. So just being a part of that opportunity to help people on a global scale. As far as opportunities for mentoring and outreach, Regeneron is committed completely to doing mentoring and outreach. So we've committed $100 million over the next 10 years to this, used to be called this, the Westinghouse Prize, or the talent search. And it's been rebranded down to the Regeneron Science and Talent Search. And it's for identifying individuals that are finishing up high school and giving them a prize each year to the top 40 finalists to keep pursuing their academic career. But during the year and during the summer, I bring in interns every year, and I continue to be a part of Leadership Alliance, where I not only bring interns in, but mentoring by afar, and making sure I keep giving back, because like the Leadership Alliance has given me so much. I stand on the shoulders of giants, so I take it as a personal responsibility to help as many people as I can to where they want. And then as far as, am I only communicating with scientists? No. That's why communication is so critical. It is one of the most critical skills you can learn and keep refining throughout your academic and professional development, because you have to be able to communicate not only your science, but to the scientists, but to the community at large. You never know when you're going to walk up to Warren Buffett and he's going to say, "You have 30 seconds. Why should I fund your research?" And he's not a scientist, but you have to be able to explain to him and break down what you do on a day-to-day basis to details that he'll understand and want to fund your research.
Yeah, I agree with everything that Marcus said. So when I was originally sort of battling between academia and industry, I knew that I wanted to stay involved in basic science, because at the time I really did enjoy being at the bench, but I knew that eventually I wanted to be a laboratory head. So I knew that industry would give me the chance to still stay involved in the basic science and possibly lead a lab group in the future. Also really like writing, so that's also something that I knew that I would be able to do in the industry as well, since we do have opportunities to publish, and like you mentioned before, you do write up your results that you obtain in the lab to submit to regulatory agencies. You also get the opportunity to teach. I give a lecture at Rutgers every year about immunotoxicology, so I think for me, industry was a good thing because I was able to stay involved in the basic research. I was able to write and was able to do teaching without having to deal with the stress of having to apply for research grants and having to build a syllabus every semester. So it was a pretty good hybrid for me. In terms of mentoring and outreach, I know BMS has what we call people and business resource groups. We have eight different groups that are based off of different, populations. We have one for African Americans, one for millennials, one for Hispanics, LGBTQ, veterans, and I'm missing some, but they are all for the purpose of mentoring and developing underrepresented groups of individuals within the company. And then within those groups, we also have our own separate outreach groups. Like I'm on the STEM committee for BOLD, which is the Black Organization for Leadership and Development. And we really cater to having outreach and sort of science experiment days for those as young as the middle school age. And we sort of follow them and track them up through hopefully when they're able to apply for a position at BMS. And we also have an initiative where we are partnering with HBCUs to sort of diversify the workforce that we have on site. So we're really leveraging some of the HBCU graduates like myself who are on site to go back into our networks and to hopefully bring in more applicants to make the whole workforce more diverse. What was the third question? I'm sorry.
Do you typically work with groups outside of the scientific community in your day-to-day?
Oh, so yes, as in addition to outside of our own individual group, we do have, we deal with clinicians for the most part, since we're in the preclinical space. We're sort of like the bridge between when a drug is tested in animal models before it goes into humans. So we do collaborate with those early on in discovery, so still the science stage, as well as the clinicians who are wanting to know how the results that we got in the laboratory can translate into a more clinical setting. And then of course you have the whole having to make sure that the public can understand the results of your study as well. So we do communicate with scientists, clinicians, and the public as a whole.
Thank you. So this next question, I think, is specific to the current time, current situation that we're living in with COVID. What is the greatest challenge of virtual teamwork within pharma at this point in time?
I guess the biggest challenge for at least where I work is that there are a lot of deadlines for everything. So just because COVID is happening, we still have to make sure that we get certain FDA files and certain things done within a certain time frame. So in order to meet the timelines, you still have to make sure that your teammates are engaged and that they're willing to do what they need to do from home and to not feel like, oh, I'm not at work, so it's not as important. Just making sure that everyone is still energized and can do what they can from home to make sure that the ultimate goal of getting the drug to the next stage gets done. So I guess one of the big challenges is making sure that you meet your timelines and that everyone stays engaged in the projects that are going on.
Yeah, what I would say, I would definitely echo everything Courtney said, but some of the other things that's been challenging is, not only are we working from home, if we have kids, they're at home. You have to be a parent, you have to be a spouse, you have to be a scientist, and it's all by still compressing everything that you do in a day-to-day. And one of the things I'm dealing with and challenged with is an increased workload. So because you're not having to go to work, though that's another hour or two you have free, people pop meetings on your calendar. Oh, you don't have to move. You don't need to go to lunch. They pop a meeting on lunch. Oh, you don't have to drive home. They throw another meeting on the calendar from like 6 to 8. And so it's just even more work going on. But one of the key things I find that the virtual challenges is that communication. So, often when I go from one meeting to the next, when I'm on site, I have that hallway conversations. And that way you get to make that touch point with somebody and get that communication going without having to set up a meeting or, go through those hassles. But now that you're at home, you don't have that personal touch to things, and things get lost in translation so often in the email. People overread the tone and it causes confusion. So, that's one of the things I've always have to, to think about when you're composing an email, a Skype message, is that communication.
All right. So the next question is specifically for Marcus. So how easy or difficult was it to transition from a startup company to a large company like Regeneron?
Well, Regeneron, when I started, it was only about 4,000, only 4,000. But compared to, say, Pfizer or Merck, which are 100,000, we're a relatively small biopharma company. For me, it was a perfect transition because what I was doing was a natural fit. So, I was running my own lab. I was running all the microbiome research for HLI, and I went into a program management role. So being in program management, it's like running your lab, except for, it's not commanding scientists and grad students or managing them. It's really managing teams. And for me, it was a natural fit for me because I could communicate with individuals, set expectations, and get those deliverables done. So it depends on the environment, right? So, you have to, everything is relative. Where those skills that transition for me to Regeneron may not have transitioned as easily at Merck or other places. So it's finding that natural fit for you.
Thank you. What are your thoughts on postdocs in industry? So this person is graduating with a PhD soon and is considering scientist positions or industrial postdocs at Big Pharma, i.e. Genentech, Amgen, Novartis. So what is your position, or what are your thoughts on that, doing an industry postdoc?
Well, the postdocs at Regeneron, it's a rigorous postdoc. So it's a great opportunity. You get exposed to drug development and how we develop and identify new targets, and you get that full exposure. But we put our postdocs on projects that are not necessarily tied into the target discovery, because we want them to have that full basic research science experience. So they're trained to go back into academia or stay in industry. So I personally think it's a great opportunity if you get an opportunity to do a postdoc in industry, because you'll get that double training, both in how to be successful in industry, but also it sets you up for success in academia as well, because you can take a lot of those projects with you back to academia.
Right. So I did an academic postdoc. I didn't do an industry postdoc, but I almost wish that I would have, because I guess one of the big differences between academia and industry is not only the differences in the business aspect of it, but in industry you also have to learn how to balance multiple targets and multiple drugs at once, which I'm assuming is that part of what you learn in an industry postdoc. So I think that would have been beneficial to learn if I could have had that experience going into industry. Had I done an industry postdoc compared to an academic postdoc, I was sort of used to, this is my project, I work on this, and I have these goals to meet for myself. I really wasn't used to, okay, a company wants you to do this, so you need to focus on this, their timeline is this, so get this done by this, and knowing when to let go of a target or project when it isn't going anywhere is really difficult to do when you spent a while working on a target and you realize that you sort of have to let it go. And an industry postdoc would be very beneficial to start learning some of those skills.
Thank you. So this next question is for someone who already received a position at a global biotech company. However, it's not their ideal fit, doesn't fit their education and background. The person wants to know, should I just take it and get my foot in the door, or continue to look for other opportunities?
I think it depends on sort of your personal situation, sort of what you were hired for the job to do. A lot of times when they hire someone for a position, they're hiring you because you have a particular skill set or something that can be a benefit to the company. So if that's something that you think that you could offer them, and you don't mind offering up your time and your energy, spending your time doing that, then I would say consider going for it, as long as it's something that you could see yourself doing for at least a little while until you can maybe get another promotion or a new responsibility. I think a lot of people think that in industry you have to sort of stay in one department, and that's not true. So even if you do take this position, you could sort of shadow people in other departments to sort of learn what they do. So if you sort of got your foot into the door learning a particular set of skills while you meet other people, you can sort of translate the skills that you have learned to how your skills can benefit another group or department, and sort of transfer. It's all a matter of balancing what you think you can do and how much you want to grow in that company.
Yeah, I think Courtney hit the nail on the head. You really have to do kind of a self-assessment. Is if you got the position, and is it something that you can deal with? Because often in companies you can't transfer between different departments until about after 15 or 18 months. So, is it something that you can do for the next year and a half or almost 2 years?
Yeah, and I would also add, if it's something that's going to get to that next stepping stone for where you want to be, then it's probably a good idea. But if it's not in line with what you want to do and you can't see yourself at that company, then maybe you want to reevaluate. So thank you for that. Next question is about company culture. So this person wants to know, what is your company culture like, and does it have an impact on your job satisfaction? Does your company try to provide opportunities to network within the company and help employees advance their career?
Well, from Regeneron, what I can say is that we've been ranked the #1 biotech company by Science Magazine, I believe 5 of the past 7 years. And the 2 years we weren't #1, I think we were #2. So, we have great company culture in a sense where it's a good place to work. I mean, one of the things that I really appreciate about Regeneron is that there's a day every year called A Day for Doing Good, where Regeneron shuts down the whole company. And it's not, you don't have to use your PTO, you don't have to use any of your personal time, but they literally shut down almost everything at Regeneron and have us go out to the community and do community projects. So it's very supportive of building up our community around us and mentoring. So we have a day of Science Day and a DNA Day where we bring in members of the community to teach them about science that we do at Regeneron, to teach them about, Kids Day, where DNA and how we can help improve those the scientific knowledge for the community. So the culture of Regeneron, it's very collaborative, and they do celebrate everyone's culture. We have different groups that, different months, different weeks, where we have these events where we're trying to promote culture and education. So as you can imagine now with Black Lives Matter, there's a lot of activity going on, not only just at Regeneron, but I can tell you at BMS and all of pharma, that we're really looking at this and trying to address some of these issues.
I would agree with Marcus. Some of the similar programs that are going on at Regeneron are sort of global company-wide, and different companies are taking their own stance as to how they want to proceed with what's going on in the world today. I know at BMS we have eight different PBRD groups that I mentioned before. And BOLD is a Black Organization for Leadership Development. So we've had a very busy time learning how to address the whole Black Lives Matter movement, how we want to spread our influence into the outside community. So there have been different health screening fairs and different things that we can do to promote healthy living amongst the Black community. So that's just a couple of things that BMS does, as well as some of the other community outreach, not only through BOLD, but we have the Hispanic group, millennial, veterans, some that I always keep leaving out, but we have 8 different groups as well. So diversity and inclusion are some big factors that play a huge role at BMS based off of the current workforce that we have, as well as trying to bring in a diverse and inclusive new scientists who may join the company eventually.
Thank you. So the next question is specific to job searching. So what would you look for in an industry job description or website to make sure the position you're applying for has opportunities for teaching and mentoring? I often hear that those experiences don't exist in industry, so I'm happy to hear you all can still teach and mentor in your positions.
I think it depends on the company and the job descriptions. I know some job descriptions may only have the technical aspect of what you'll be doing, but then they'll have other things like BMS or Regeneron is a company that focuses on developing its employees and sort of different verbiage like that. So your initial screen would probably be with the hiring manager. So those are definitely things that you can ask during some of your initial phone screens, as well as some of the in-person screen that you'll have with the hiring manager, who would end up being your eventual manager. Always feel like you can ask whatever questions you want to during the hiring process. So that those are things that are important to you. You can make sure that you ask those who are involved in the hiring process to let them know that that's something that you would like to bring to the company if it's not something that is there, or if it's something that is there, something that you would like to participate in.
Yeah, and the only thing else I would add is, like in Regeneron and BMS, all of the industry companies, we have these internship programs. Regeneron, we bring in 400 to 800 students every summer. They go into our labs, our business development and marketing. We're part of the Build program, where we're bringing, have individuals rotate between different companies, so they get that experience of Regeneron and then across other departments. We bring in interns from, say, the Keck Institute that's in California, where they come and learn about program management and some of those opportunities. So, I would say in pretty much most pharma companies, that mentoring and teaching aspect is built into the culture.
Okay. So the next question is specific to the difference between working in startup versus big pharma. What did you learn, and what is the work culture like in each environment?
In a startup, when I started, there was only 7 of us, and we quickly grew to 300. And there's a lot of excitement. You have this big bolus of money, and people, and you can burn through it pretty quickly. But it's, you have the resources to just take on big ideas and just try something, be very innovative. So startup companies, it was definitely an exciting experience, just because you get to be involved in almost every decision, especially when you're at when you start at the ground floor and help building the company up. In a pharma company, it's being a part of a global mission where you're looking at developing therapeutics that can help hundreds of millions of people. So it's looking at the scale and breadth of things. So in a startup company, excitement and thinking about bold new ideas, and big at Regeneron as well. We're thinking, always pushing science and developing new technologies, but it's having that major impact on how we can impact the world.
Thank you. This next question is specific to Dr. Newsome. So in working with clinical trials, I assume you also meet and work with MDs. As an aspiring MD, PhD with an eye for industry over the clinic, what are some marketable skill sets you've seen with the MDs work with that can be applied towards my training?
I think that's something that would be really beneficial, as an MD is someone with really strong communication skills to where you can translate some of the science verbiage to more sort of a general population. So if I'm coming to you and saying, this drug modulates the XYZ pathway called exaggerated pharmacology on these cells of the immune system, blah, 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 you need to be able to sort of tailor that to be able to explain it to sort of someone who doesn't have a science background. So I think communication is one of the big keys that we enjoy working with when we see some MDs, people who are really able to translate some of the science and the pathways that we've seen. You do have to be able to still, of course, understand it, but being able to explain it in maybe not so complicated terms is a really important skill set to have.
Thank you. So I think that was the last question in the chat. Are there any other questions from the audience? If you want to ask the question yourself, feel free to unmute yourself and turn on your video if you'd like to, or just unmute yourself, but we still have time if anyone has additional questions. Okay, so we just got another question in. What is a typical day like in industry?
I don't have a typical day. I mean, I guess typical, as I should say, I don't have the same, I never have the same thing happen every day. Every day is different. So I would say a typical day is me going to meetings, but really working with my teams to understand where we are on specific projects and how we need to, what we need to do to drive them to the next stage in the research and development. So, setting up those cross-functional meetings and working across the aisle with our clinical teams to make sure we're doing everything up front to put them in the best position when they start doing target development. So it's really, a lot of meetings, but I most of those meetings are more in strategy sessions. So, not necessarily reviewing data, but thinking more strategy on how we look forward, what are we doing now, but how should we prepare in the next 10 years for things?
Yeah, so I think that a particular person's day may depend on what your role is. I know for me, my role isn't the same every day either, because I may have to spend some time managing my direct reports and figuring out what they need to get done for the day. Some days I might need to actually go into the laboratory myself if we are tight staff and they need my hands to do something. Some days I may need to write a report if we need to get something for filing. Some days I may need to look at the data that's coming out from the scientists in the lab to interpret it and draw the conclusions. So it varies from day to day, but if you are in a primary laboratory role, then of course your job is going to be in the lab for most of the day. We hire some individuals primarily as scientific writers, so their job is at the computer writing the results all day. So I think your day varies depending on what your job title is, which is why it's really important to really look at the job description and when you are applying to sort of ask those questions when you interview. If you know someone who has a similar position that you're applying for at the company, ask them, what are your day-to-day roles? And if they say, oh, my day is writing all day or I have meetings all day, if you know that, I don't really like to do that, then you know that, okay, this isn't the right position for me, so to keep it moving. So I guess the big answer, it varies day to day, but make sure that if you are thinking of applying, ask someone in the similar role that you're applying for what their role is.
Thank you. And it looks like Aurora Washington turned on her camera. So did you have a question, Aurora, that you want to ask?
Yes. What are some resources that you wish you had as a graduate student that would have better prepared you for a career in industry?
I guess some resources or maybe some skills that I had is that, which is partly my fault. I was so focused on the science when I was in graduate school and postdoc. I did presenting and some writing and just committee work and things like that. But I really didn't understand how industry is a business and how important some of those soft skills, people skills are. So I think I really would have spent a lot of time sort of building up my network a little more and maybe learning how to write different types of documents. I don't know if that's a really good way to put it, but I guess I really would have just focused on some of the soft people skills more, not only the scientific aspect of research.
Yeah, I would echo that because, you know, often as a grad student, you're very focused on your part of the project, what exactly you're doing so that you can publish or graduate. But you got to learn to see the forest from the trees. You got to learn to step back and go 10,000 feet and see how the broader picture is. You can't get, you know, you have to be able to drill down and understand what you're doing, but see how it fits into the broader scientific goal of your project and just how it in science in general.
All right, we have another question in the chat. What was the hardest aspect you had to adjust to when you transitioned from academia to industry? Is there anything you wish you'd done during your PhD to prepare yourself better?
Well, I guess the hardest aspect I've had to adjust from academia and industry. In academia, I really set my own schedule. You know, even though it was crazy, I would go in like as a grad student and as a postdoc, like at 6, 7 in the morning, stay in the lab. I loved the lab, so it was fun to me. But then I would leave whenever I wanted to, and just, you know, I can go run or go play basketball, do whatever I want. In academia, I'm sorry, in industry, you're working for a company. And it's not a 9 to 5, you know, some days it's 6 to 6. So it's really being, you know, more tethered to a schedule, because those meetings, they don't move because, oh, I want to go run or do something like that. You know, you have to be at those meetings and you're accountable for being there. So it's, you know, you have more of a structured schedule in industry, I find, compared to what I had in academia.
Yeah, I would agree. I think in addition to the whole scheduling changes, I think one of the biggest differences for me was having to learn how to balance multiple drugs and multiple targets at once. I know in academia, you have your project and maybe a couple of side projects that you're focused on, but at least in the department that I'm in, we're in drug safety evaluation. So any drug that may have an effect on the immune system comes through our space for safety assessment. So I have to keep track of several drugs in my mind at once and have to remember, okay, this drug affects this pathway, this drug affects this pathway, wait a minute, this drug causes exaggerated pharmacology of XYZ cells, this drug does not. So I think having to learn how to balance multiple different projects at once was probably one of the biggest things that I had to learn how to do, as well as how to let a project go when it isn't going anywhere. I know as a graduate student in postdoc, you can milk a project until you have reached no further endpoint. Do not pass go, stop here. I know in industry that point comes a lot earlier because they aren't going to invest as much money into a target or a program or a drug if they know that there are safety issues or if it's not responding as they hope that. I know I worked on one drug I've been at BMS for at least 5 years. We had to have been working on some of this drug for at least 3 to 4 of those years, and they ended up what they call killing the drug, so no further development. We did publish something about it. So the hardest part was learning how to let something go when you invested so much time and energy into it. It was something else that I had to learn how to deal with.
Great, thank you so much. I don't see any other questions in the chat. Is there anyone else that wants to unmute and ask a question themselves, or are there any additional questions for our panel today?
Yeah, actually, I don't think I heard an answer to the question that was posted earlier, but I was really happy to hear that all of you had some teaching slash mentorship experience in your positions. Do you have any advice for looking for industry positions that still have that?
Well, Regeneron, I'm sorry, Courtney, do you want to go ahead?
So when you say looking, do you mean will that be something that's specifically spelled out in the job description? I guess I'm a little.
Yeah, I guess for me, I've often heard that those opportunities don't exist in industry. Like you should go into academia if you're interested in still being able to teach. Like you said that you lecture at Rutgers occasionally. So do they spell that out sometimes in positions, or is that something you have to ask about?
It depends on the position. And sometimes it may be in the position, or it may be an actual part of the role. Like part of your role may be to serve as a university liaison between the department and the university. So it all depends on what the position is. But if it's not there, that's when you definitely reach out to HR and the hiring manager if it's not spelled out. Sometimes it may not be, sometimes it may be. It all depends on the position.
Yeah, if you find a role that you like, so like if you want to work in a lab, and you get that interview, once you're on that interview, you ask the question: is there an opportunity to do mentoring or to take part in seminars or things like that? You have to ask. But like Courtney said, it depends on the role. So at Regeneron, we have a whole office that's dedicated to mentoring and science education. So if you're looking for something like that, you can, that whole role is dedicated to that. Or medical research scientists, I think that's their new name, but they literally go into the community, into academia and to physicians, and just talk to them about the science we do. So those often have opportunities to go speak to undergraduates or graduate students. Myself in research program management, I've been a part of the Leadership Alliance. I come back all the time and I mentor students. Every summer I have at least 2 summer interns. But then I also go to talk to the SPURS program at Columbia, or go back to other academic institutions, or back to Southern where I did my undergrad, and I get a chance to go back and mentor those students too. Other programs we have some of our scientists go to the communities, and one is with the Amish, where we have a clinic every year to talk about what we've learned in the genetics of the Amish, and really talk to the community about their participation in some of the studies.
Yeah, I think it's important to remember too that when you are applying for a job, you're interviewing them as much as they are interviewing you. So if that's something that you are interested in doing, you can always say, hey, I think that this is important. Is this something that you think that we could, do in terms of our department? That would be something that could help them learn and grow as well, because every department wants to learn and grow and have more outreach, especially in the current climate that we're in now. So if that's something that you can bring to their organization, that could possibly give you a heads up over someone else who may be not interested in that, or they haven't necessarily thought about bringing that to the department. Any shift in the culture like that could sort of help an organization learn and grow would be very much appreciated.
Thank you.
So we have a few more questions that came into the chat. Someone wants to know how they can get in touch with both of you in the future, if they can connect with you and network.
Sure. I guess, can we just type our email address maybe in the chat box? I'm technologically challenged, so I guess we can just type it in the box. Maybe I'll type it in. You can let me know if you see it.
And I think all of our contact information should be in the program, but yeah, I'll add mine as well.
Yeah, and if you just search for us on LinkedIn, you can find us there as well, and we'll add you.
Thank you. So the next question, in academia, we have committees to check up on progress, etc. In industry, I've heard there are also performance reviews on top of also assessing how people get along with others. Is this true? And can you comment on the type of mentorships that occur within industry?
Yes, so in terms of the performance review process, I know everything is different between different companies, but at BMS, we have sort of a mid-year review, or mid-year check-in, as they call it, and then we have the final review at the end of the year. So at the beginning of the year, you set your objectives based on what the company's goals are. So if they're saying your goal is to achieve 4 to 7 first-in-human drugs in this amount of time, then that's like a company-wide goal that you'll have in everyone's objectives. But then within your own department, if your management is saying you need to have XYZ done, and that goes into your objectives as well, and then you'll meet at mid-year to figure out how well you're reaching those goals, and then at the end of the year, you'll get an actual rating. I know for us, it's you're exceeding the goals, you're meeting the goals, or you're not achieving. I think it's what they are. So in addition to the output goals, you're also rated on your behavior, some of the soft objectives that I mentioned. We have 6 core behaviors: passion, accountability, innovation, urgency, diversity, and inclusion are all part of the behaviors that you have to, that you have to demonstrate. So all of those are part of your ratings, as well as a certain percentage of your rating is based off of your output, and a certain percentage is based on your behaviors. So you can't just be good at your job and then have crap behaviors. That won't go over so well. It has to be a good balance of being a good scientist and being a collaborative co-worker that everyone likes to work with. You can get your work done with urgency, and you understand the importance of listening to different diverse viewpoints.
Yeah, Regeneron's similar. We have a mid-year and an end-of-the-year check-in, and the good thing is, it's team to team and company to company dependent, but we give continuous feedback. So to my team, I have 3 scientists that report to me. We get feedback every day. We have joint team meetings weekly. So you're not getting to your mid-year or end of the year and you're like, hey, where did this bad rating come from? Mm-hmm. We're constantly giving feedback. And so it's that you get that continuous, but also that mid-year and then end of the year review.
Yeah, I think that was enough. What was the other part of the question? I think I missed the other part. There was.
Also, can you comment on the type of mentorships that occur within the industry?
Oh, so do you mean mentoring that you would get, or mentoring that you would give outside of the community? Because there are both that happen, I'm sure, within Regeneron as well. So in terms of you receiving mentoring, we have mentoring that occurs within our own department. So I'm in drug safety evaluation. So we have our own mentoring department to where someone who's a few levels above you is sort of assigned as your mentor. If you would like, it's not mandatory, but you can have an upper level mentor that you would like. There's also mentoring through some of the people business resource groups that I mentioned. Like you can have a female mentor if you want one through BNAL, the BMS network of women, and you can have a Black mentor through both. So there are several opportunities to be mentored. And like for me, when I'm transitioning to a management role, there was a whole new manager mentoring program that I went through. Someone who had been through managing for years, was sort of able to help me know what challenges I would face and sort of help me get through the first few months as a new manager. So there are several mentoring programs that you could receive, as well as some of the outreach programs that Marcus mentioned that they do at Regeneron as well.
Yeah, and like I mentioned, we give continuous mentoring feedback to at least my team and my supervisor to me. So they're constantly not only hiring folks, but my goal and my supervisor and theirs is really the goal of every good hiring manager is to be reporting to your people one day. So I want to be reporting to the people that report to me. That means I've done my job. So I mentor in that fashion because I want to be able to report to them one day.
Thank you.
Yeah, you never want to be the smartest person. And I know I rely on my team all the time because I may not know all the laboratory techniques that they do because they're in the lab more than I may know. So if they're saying, if I look at the data and say, oh, this experiment didn't work, what happened here? They may say, oh, I can see that didn't work because we didn't do XYZ in the lab. So yeah, you never want to be the smartest person in the room, and always make sure that you mentor and lead your team so that they can help you learn and grow as well.
So there's another question that came into the chat. What advice would you advise scientists that have spent the majority of their time in academia in terms of transitioning into the pharma industry? So someone who wants to transition from academia to pharma, what advice would you give them?
I think about it as, one, making those connections, going to scientific meetings and presenting your work. I mean, pharma is always looking for good scientists, and we definitely attend all of the major scientific meetings. I go to the American Society of Human Genetics every year, except for this year. But we go there, we look for strong academic scientists to bring them a part of the team. So, I would say the best advice is be the best you can in your field, and be able to communicate your science. And that will definitely catch the ear and eye of some of the pharma industry.
Yeah, I echo that same thing. Go to as many conferences as you all can, because we also have booths set up at certain conferences that we go to. So don't be afraid to go up to people and ask them different experiences and how it is to work in their company. So definitely building up your network by going to as many conferences as you can go to. Present your research. That can be through posters or oral presentations, because you want to let those who may hire you know that you are a subject matter expert in your particular field. And the best way to do that is to put yourself out there by going to either meetings, posters, orals, publications, etc. So just making sure that people know who you are, either through your networking or through your output of your work.
Okay. We have one final question in the chat. Do you have any advice on how to create a resume from a CV?
I think in terms of the CV, it's just to make sure that you highlight the most relevant information that's most relevant for the job that you're applying for, and sort of cater the verbiage for that. I think part of the issue that I had was I was having so much information on my CV and resume because I wanted to include everything that I did, but some things weren't as relevant for the jobs that I was applying for. So it made it look like I was a little all over the place because I had so much that was on there. So sort of catering it and making it not necessarily smaller, but making it so that it's clear that you're interested in a certain position, not just that you just have a global resume that you're sending everywhere. You want to make sure that's specific for the role that you're applying for.
Yep. Great. You're on mute, Thais.
Sorry. Are there any other questions? We have about 7 minutes left, so feel free to use the time. If there are no further questions, you have both Dr. Jones and Dr. Newsom's email, so you can connect with them via email or LinkedIn, but the floor is still open if there are additional questions.
I have one more question. So right now where you are, do you see a ceiling for yourself in industry, or like a point where you would want to exit, or are there always opportunities to kind of move up in industry?
Well, I can speak from Regeneron. I don't see a ceiling. I guess the ceiling is I can't go past George, who's our senior vice or chief scientific officer, so I can't take his job quite yet. But there's definitely room for me to grow. And that part of having a good mentor or hiring manager is someone that's committed to developing you so that you can want to grow, or they want you to grow as well. So when you're looking for an opportunity in industry, make sure the hiring manager is someone that's committed to your development and growth, professional growth.
Yeah, I would agree with everything that was just said. I know when I was applying and looking for jobs, I made it pretty clear that I wanted to lead a laboratory group one day. So the person who's got my manager, she knew that from the get-go. So she has slowly given me direct reports and sort of new responsibilities to do. So I think it's really important to make your career aspirations known when you do go into sort of a new role, so that you can grow as much as you want. I don't think there's necessarily a ceiling, unless like what Dr. Jones was saying, you can't go over someone who's still there. Like I know my boss said she's going to leave in about 4 to 5 years. I'll I guess take her role when she leaves. So I guess there is a ceiling in terms of that, but you also have to think of that growth isn't necessarily upward. You can grow outward as well into different departments. So there's also those opportunities as well.
Any additional questions? Okay, well, thank you everyone for joining us. I hope you enjoyed the program today. I definitely learned a lot, and thank you so much to our speakers and to our panelists, and to Dr. Newsom and Dr. Jones for volunteering their time. As I mentioned before, they have both put their email in the chat if you'd like to reach them. And also they can be found on LinkedIn. So thank you everyone for joining. And, we hope that you will stay in touch with the Leadership Alliance. Please connect with us on TLA Connect. We frequently post job opportunities and other events that we have going on there. So feel free to connect with us. And we hope everyone stays safe during this time.